I'm Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Knee to Know Show, we're going to talk about goblet squats and why they can be a very beneficial exercise and part of your preparation or recovery after knee replacement surgery. Hey everyone, so today we're talking about goblet squats. So first let me do an overall example and demonstration of how to perform the exercise, and then I'll talk about some of the benefits and why it might be a good exercise to start to incorporate as part of your preparation or your recovery from knee surgery. So what you need is, usually you can use a dumbbell. So I have a dumbbell today, 30 pounds. Of course you can get a weight that is comfortable and appropriate for you. If that's a little less, a little more. You can use a dumbbell, you can use a kettlebell, you can use something that you can be creative. If you have a heavy textbook or a heavy something, whatever it may be, you can use a weighted plate from a gym, works as well. Any kind of heavy thing that you're going to be holding in front of your body. So the good thing with the kettlebells and with the dumbbells is you actually have a good place to grip and hold on to when you're doing it. So what you do is you're going to hold the weight in front of your body like this. So both hands, one on each side, kind of cupping underneath the dumbbell. You can kind of see how it looks like a goblet, like a big cup or a goblet. And keeping feet about shoulder width apart, maybe a little more. You can keep the toes straight or point them out a little bit. And then keeping a good upright trunk, a good back position. Don't want to curl down or anything like that. And you're just going to come down, trying to get to about 90 degrees, and then come back up. Of course, if you can go nice deep and nice and low, that's great. If you're only a little bit less, you can start there and kind of build your way up as you feel more comfortable. You're still going to get some good benefits. The arms and the kettlebell are going to actually come between the legs, so you might want the legs a little bit more, a little bit wider than your typical squat, but about normal, about shoulder width is typically okay. Now, some benefits of this is, one, the kettlebell actually acts as a counterweight when you're performing a squat. So unlike doing like a back squat with the barbell on your back, the kettlebell or the dumbbell in front of you acts as this counterweight. So what it does is it allows you to kind of sit back more into the squat. So if you have you might not have as much strength or stability as you want, but you're able with that weight to kind of sit back into the squat a little bit further. And that's a good thing for, one, good posture, good positioning. It helps you get a little bit deeper into the squat, a lot of people notice. And also, your knees typically aren't going to track forward too much. It's going to keep the knees back a little bit because you're bringing your hips and pelvis a little bit further back. And that's a positive thing if you're someone who has knee pain, someone who's recovering from knee replacement surgery. The more your knees are going to track forward, so the more the knees are going to come up to the toes or over the toes even, that's going to put more stress, and it's going to make the quadricep muscles work a little bit harder, put a little bit more stress through the knee joint, which of itself isn't a bad thing. But if you're someone who has a lot of knee pain, someone who's recovering from knee replacement, you might not be able to tolerate that quite as easily as someone else. So an exercise like the goblet squat, you're able to kind of sit back into the squat a little bit more, which allows you to put a little bit less stress through your quadriceps, through your knees, and have the glutes help perform the work of the exercise a little bit more. Another benefit of the goblet squat is it's very functional. So you think about bending over to pick up a box. You think about bending over to pick up a grandchild, pick up toys, whatever it may be. A lot of times things are in front of your body, in front of us here. Not very often do we take something from up behind our back and grab it like that. A little bit different, but still I think is a benefit of doing a goblet squat. A little bit more functional, but a little more normal hand and arm position and position of where the weight would actually be when you perform a task such as picking something up. Just to look real quick here, make sure I'm not missing anything. I think I hit most of the key points. So goblet squat, again, also it's one of those exercises where you don't need a whole gym, you don't need barbells, you don't need all that stuff. If you have some dumbbells, if you have something heavy that you can hold in front of you, you can perform the exercise a little bit better, a little bit easier to perform at home or wherever you may be. A little less technical as well. You don't have to have as high of a technical skill level or experience as doing such as a back squat or a front squat with a barbell. So overall, I think it's a really great exercise, something that you can obviously easily progress, increase the weight that you're holding, make a little less challenging, decrease the weight, and something to learn the movement of a squat well too, and perform an exercise that's going to really strengthen your legs, strengthen your quadriceps, strengthen your glutes, and do so with pretty good technique, with less training, and some practice a little bit. That's the goblet squat, a good exercise, one of my favorites to do with people as preparation or recovery from knee replacement surgery. This has been the Need to Know Show. As always, please check us out, leave your comments, leave your questions. If you love our content, if you like our content, be sure to subscribe, click that button in the corner, post content every day, everything related to knee pain, knee arthritis, knee replacement surgery, preparing for surgery, recovering from surgery, and any frequently and commonly asked questions. Thank you very much for watching, everyone. Take care.